Greetings, family. Happy to see you all. I have a special guest for you all today, Dr. Biko Sankofa. Dr. Biko, thank you for joining us. Will you introduce yourself to the crowd, please?
Thank you. Well, thank you for having me. Um, as you indicated, I'm Dr. Biko Sankofa, trained as a developmental psychologist, Howard University, and I focus on the life path development of the individual. Um, in spite of the fact, my office in Chevy Chase, Maryland, we do transcranial magnetic stimulation, which is TMS, dealing mainly with depression and anxiety patients, and TMS can be considered something similar to electroshock therapy without any side effects, but only because we have a electromagnetic coil that is placed on the person's um, head based on a type of mapping that we do to identify the area whereby depression and anxiety may actually reside.
Wow.
So I am a development psychologist by training, and in regards to what I do is more so an area of psychospiritual development, trying to assist the individual to reach their ideal self or reconnect them with that which is their purpose and the greatest intention for themselves.
Thank you. The doctor is agreed to speak to us today about mental health and how it affects the males in our communities. We often talk about women and mental health, women and all kinds of other health issues, but we never really reflect on the brothers, the kings. And I wanted to have the doctor address that. Being a mother of a son, this is an important topic. I want to make sure it's not overlooked. And I think that the doctor is going to shed some light on that for us today. So, Dr. Biko, please shed some light on it for us.
Well, hello everyone. I'm glad to be here. I work best with maybe a question being asked of me, generally in regards to African American male or and issues in regards to health and wellness. It is historical, genetics, biological, psycho, spiritual. There it cuts into so many different aspects, departments, and hemispheres. But at the core of it is really about our ability to be empowered with choice. And you imagine, let's say depression, for instance. If you feel that you have an alternative to your situation, if you feel that you can turn left or possibly right, and you have those alternative options, you feel a little bit more empowered to say, okay, I don't have to stick with this particular circumstance. And if you feel that this is all that you are going to experience for the rest of your life, it produced this despondency, sadness, depression. And
Mhm.
if day after day and week after week and months after months you're experiencing the same challenge without the ability to make a choice, um, that depression becomes something called chronic. And for that individual, it may be, well, I may as well just not be here.
Yeah. We've been seeing, and when I say we, I have this thing where I feel like when I'm reviewing things, all of these different parts of my personality question what I'm seeing, what I'm reading. And I've noticed a lot of headlines on the continent talking about young men that were committing suicide. And that's what really sparked the idea that this was a topic we needed to talk about, males and mental health. And a lot of the suicides were related to, it was various things. And like you kind of summed it all up in one. But one of the things was They were very bright individuals, very intelligent, at the top of their class. And if their grades didn't come along the way they thought they should have, or they were having a challenge with their education, they committed suicide. And everyone was surprised by it, And then there was another situation where folks were killing themselves, males, because of spiritual beliefs, believing that they were cursed. I'm not really sure what the curse was about, or if it had anything to do with gender identity or anything like that. Obviously, they felt it was something that was unacceptable and couldn't be changed, or I imagine that's what they felt, or they wouldn't have resorted to such extreme measures. Um, and I think lastly, it was about over relationships, maybe a bad breakup, or, someone wasn't in love with them anymore. And those were the three major themes that kept coming across, that this is why these individuals chose to end their lives. And they were young, they were like 19, 20, which in my mind, like the brain is still developing at that time, even though you think you're an adult, there's so much more development to happen at that time. So I was like, I really need to address this with the doctor and see what he has to say, because I think people are really quick, especially religious institutions, to say things like, oh, let's just pray on it, and sometimes just praying is not enough. Like, you need prayer and you need action. So I like to think that you're bringing the action, right? You're going to show folks like how we can proceed and where this is coming from.
Well, we have nature and nurture in all things, right? Things that are just genetically inclined. And of course, a parent or a close relative could have a predisposition to mental illness. And in those instances, you could have inherited those those traits as well.
Mhm.
And let's say it's schizophrenia, let's say it's depression, anxiety, or whatever the case may be. And then you look for some sort of treatment, which may be in the form of medication. But then you also have, nurture. That's which codifies, within the reality of the environment that you're living in. And you can really exhibit the same type of mental challenges as someone essentially who has a genetic predisposition based on the situations that you're confronted with over and over and over and over again. And when you're confronted with those situations in your environment over and over again, your sympathetic nervous system, it kicks in regards to this fight or flight. But if you don't have the ability to fight or flight, so let's say that let's give the for instance of being historically on the plantation, and you're experiencing a multitude of abuses, challenges, hard times on a normal daily basis, and your parasympathetic nervous system kicks in regards to energy being placed in certain areas of the body, whereby you have a more greater blood flow to your arms and you have greater blood flow to your legs. So you're either going to fight or you're either going to flight, right? But you can't run away from the situation, and you can't fight the the slave master. You don't really have a choice. You can't go left, you can't go right, you don't have an alternative. And in those instances, your the adrenaline that's in your body, which is naturally there to defend yourself, well, what happens? It dumps itself into the body, and the body becomes agitated. And over and over and over, when the body gets dumped with what our body naturally produces to defend ourselves, and we cannot defend ourselves, it turns on itself. And when it turns on itself, our body starts to deteriorate. So historically, um, we are confronted with situations within, from the plantation to postbellum period, in regards to Jim Crow, in regards to all of the various inequities that were part and parcel of the infrastructure of America. And you find yourself in crowded cities, you find yourself in inadequate health services, being able to take care of some of the challenges that come up from being in a stressful environment. You find yourself in a work environment that's not giving you the type of economical, equities. So all of these elements in the environmental situation create stress. Uh, we we call it a silent killer, but it's not that silent. It is there in front of us, and all of our senses are in tune to the stressors in some of these uh, individuals' lives. The black man are confronted with a protector provider faculty. It's historical. It's biogenetics. And you have a stronger upper body. You have stronger thighs in some instances. Don't get me wrong. We have some sisters that are very strong, but genetically, the men are protectors and providers. But then if you can't protect and you can't provide, it creates within you a type of dissatisfaction with yourself and a mental image and a self belief that you don't really have the self efficacy, the capability to achieve a successful outcome in this particular situation. So if you look at the plantation, you have a dominant force over you, uh, not really allowing you to have the choices that you need to create a successful outcome. Your freedom, your liberty, but and then you see a very challenging particular day or particular time, and the fight or flight kicks in. You can't really do anything, so then
Right.
you go within. You go into this place of sadness, despondency, depression, and this is happening over and over and over and over again. The body starts to the immune system and becomes stressed, and it's like a goalie, and that goalie is on the soccer field, and these balls are being kicked at you, and you're able to block a few of them, very well. But every once in a while, one gets in. That's an opportunistic virus or disease. You catch a cold, you get over it in 2 or 3 days. But then after a while, these balls that the goalie is is stopping from getting into the system, they're gonna become more and more able to penetrate as the immune system becomes more and more bombarded. It, at one point, a ball gets in, it becomes the last straw on the camel's back, and the system essentially cannot really defend itself. So, as we are in society constantly being bombarded by stressors, and our immune system at first is going to be pretty strong. We're able to be resilient. We're able to bounce back. We're able to deal with it. But after a while, years, it takes a toll. And on one particular instance, it might not be anything that's significant. It might be a cold, but it turns into pneumonia because of the low immune system. Um, and then it turns into a situation where the body cannot heal itself. So if you look at it from a biological position and from a historical genetic position, we were well equipped to survive, and to survive we had this fight or flight. And if the saber-tooth tiger or the plantation master attacks us, technically our fight or flight kicks in, giving us extra strength to be able to defend ourselves. But if you cannot defend yourself, then you have to go within. You have to take it. And either the saber-tooth tiger is going to do what? Devour you, and your species is pretty much going to perish. Or the slave master is going to beat you and and dominate you, and you have to sit there and take it. Now you may not be devoured that day and that minute, but after constant years and years and years of that type of brutality, your body, but also your mental stability is going to wane.
Wow. That is so powerful because what you just said, the example was amazing, right? Because that analogy just brings so much light on the situation when you talk about going from, having that low immune system, and depending on how low your immune system is, going from a cold to pneumonia. It just made you think about someone who might feel sad because something happened, but now because of their self-esteem being so low, it's taking them to a place that they don't even know they're in mentally.
Well, when you speak of young men, and you say, well, why are these young men, you know, taking their lives? Well, it may not be that instant. That instant might be the last ball that gets in regards to that breakup.
Yeah.
But before that, it's not necessarily that the individual themselves might have gone through traumatic instances, but they may have observed it in regards to significant others. And when
Yeah.
you observe the other men in your neighborhood, in your community, in your society, sustaining a significant amount of abuse, and you see them as you and you as them, you see what's in store for you. Now you're 16 or you're 17, but this is a 25, this is a 35, this is a 45-year-old man, and he looks like you in regards to ethnicity, in regards to being in the same neighborhood, having similar beliefs. Well, why couldn't that be me? So basically, I don't see myself being able to get out of this circumstance, whether it be real or fictitious. So now I'm seeing that at 10, at 12, at 15, once I have some cognitive ability to see beyond myself, and I can really empathize with society and others in society, I start to see, well, and I start to gain greater awareness of what's going on around me. So it doesn't have to be me personally and individualistically experiencing it, but just by the collective consciousness of me being aware, I can go into depression. I can experience what that individual, and we all went through that with what we have been seeing in our media in regards to these last 12 months.
Yes.
The protests, the Black Lives Matters, movements and so forth. We have sat and we have, been there, even though it was miles and miles away. It brought about a lot of stressors, with that
Yeah.
within all of us, and our fight or flight kicked in because at certain point, some of us really wanted to get up and go out there and do something, though it may not have been happening in our neighborhood, in our city. We were like, no, this is not right. This is not right. So
Yeah.
so the depression can be vicariously, felt. Um, and then now you're feeling that in some way, at 13, and but you're resilient, and you have a supportive environment at home, so you bounce back. And then at 14, you experience something else. Maybe it wasn't you, maybe it was a cousin, maybe it was an uncle, maybe it was a close male relative. Boom, you get hit again. Your sympathetic nervous system kicks in, the fight or flight. You're like, wow, what am I going to do about this? Am I going to go out there and fight, or am I going to run away from it?
Yeah.
You calm down, the parasympathetic kicks in, you calm down, you establish homeostasis in regards to balance. And then at 15, something else happens. It's part of your memory, in a sense. And when someone is asking you, what's going on with you, it seems like if everything in your life is going on okay, you're getting a 3 square meals a day. You have a roof over your head, and most of your needs are being met. However, from a psycho-emotional point of view, you're able to really move away from yourself in the comfort zone that you existed in, and actually see what folks who look like you in your society uh, are going through,
Yeah.
and how their bodies are being used and abused. um, and a part of your uh, belief system starts to give way in regards to, wow, this is me. This is my future, this is my destiny. And if you don't really have an alternative to go left or to go right, if someone else is not mentoring you, which is something that we don't have, mentors to come and say, yes, this is true, let's absorb it, let's deal with it, let's not push it under the rug, but let's put it in its place in regards to how we can be empowered to make some sort of difference. How we can, take the lash, but yet, be resilient enough to get up and to, keep on fighting in some other way. Maybe it's not with the fist, but maybe you may decide to empower yourself with education to become a an advocate for justice, and to really, use whatever means necessary to go out there and fight. If you don't have a mentor, if you don't have, someone to guide you in that particular direction, and to help you with some level of support, to get there, you may not see, you know an outlet, for you, and therefore you go within.